Hey guys, my name is Taya and I'm here to be talking about ultrasound imaging, how it works in medicine, all the physics behind it, and the benefits and limitations. So, here we go. So basically an ultrasound is sound or other vibrations having an ultrasonic frequency, particularly used in medical imaging. And the principles relate to the way a sonar on a boat works, using echolocation. There are many procedures involved with ultrasound imaging, and this can include assisting with other medical procedures or result in diagnosis of tumours, cancers, and other abnormalities. Ultrasounds use safe, simple procedures that will not expose a patient to ionizing radiation. The ultrasound is known for being quite versatile for diagnosis and its different procedures, and some popular procedures used in ultrasound imaging are pelvic ultrasound, transabdominal ultrasound, transvaginal ultrasound, obstetric ultrasound imaging, biopsies, ophthalmology, and cardiovascular ultrasound. Here is an example of a carotid aorta ultrasound, and here you can see the aorta, the vertebral body, and the inferior vena cava. So here is another example of an ultrasound, only this time we're looking at a biopsy. So what is happening is there is an abnormal mass in the breast, and you can see the needle about to enter the mass. The average ultrasound machine has three fundamental parts, and they are the transducer or the probe, the central processing unit or CPU, and the display monitor. But the transducer is the main part in producing the image. It emits the sound waves and receives the reflected sound wave, and then this data is sent to the CPU. The CPU is ultimately the brain of the machine, as it sends the electrical currents to the transducer, which get converted into mechanical waves. It then receives data from reflected waves and calculates an image which is shown on the display monitor. Ultrasound procedures will always include gel being applied to the part of the body that is being examined, and this is because we need to remove the air pockets between the skin and the transducer, as waves do not pass efficiently through air and the image will be deformed. The sonographer will sweep the transducer back and forth on the part of the body with applied pressure. Probes are used the same, but gel is applied over the probe prior to insertion. Obstetricians and radiologists are often able to review images in real time to provide the patient with a diagnosis, but otherwise the patient will receive their results later. The transducer converts the received alternating electrical currents and converts them into mechanical waves, generally at a high frequency of 1 to 5 MHz. It does this by reacting with the electrical pulses. The piezoelectric crystals change shape and size, and this causes them to rapidly vibrate, generating an array of mechanical waves that travel outward. A vibration source in a mechanical medium will result in longitudinal wave propagation, compressions, and refractions. It emits the converted sound waves from the face of the transducer, and the particles will move in the same direction as wave propagation. The ultrasound waves that are emitted will always be perpendicular to the transducer. Frequency is defined as the number of mechanical waves per second, and most ultrasound machines use frequencies anywhere between 2 and 15 MHz. These ultrasound frequencies are higher than the human auditory range, as the human maximum is 20 kHz. The velocity of the ultrasound in a specifically chosen medium is equal to the frequency multiplied by the wavelength, and high frequencies are more efficient at producing high-resolution images, as when the sound waves encounter particles smaller than that of its wavelength, it won't be detected and the image will be scattered. For a high-resolution image, the pulses must be short. Only low frequencies can propagate through air at a speed of 300 meters per second. But low frequencies provide suboptimal results in imaging and diagnosis. Sound velocity in tissue is 1540 meters per second and 1500 meters per second in water or body fluids when they are room temperature. Artifacts and attenuation can distort the accuracy of the diagnosis and the image displayed on the monitor. Artifacts may distort the size, position, and the shape of the structures being examined. They can also show structures that are not present. The sonographer must have acute knowledge of the presence of the random artifacts, and attenuation is caused by scattering, absorption, and reflection. The reflected echoes is dependent on the density of the object and how it responds with its surroundings. When the CPU receives faint echoes, a dark image will be displayed, and strong echoes are displayed as lighter images. When the transducer receives an echoed wave, the reverse of the piezoelectric effect occurs. The crystals will vibrate and deform, but they will emit electrical pulses that will be collected by the CPU and generated into a real-time image. The benefits of an ultrasound include it requires little to no preparation, It's the only method of observing babies in the womb. It helps guide other procedures like biopsies. It is safe and non-invasive, and it does not use ionizing radiation, nor does it expose the patient to radiation. There are no substantial ill effects that have ever been documented, and it is really good at getting images of soft tissue diseases. And it can show the difference between fluid and solid cysts and tumours. However, there are some limitations, and these include that sound waves are interrupted by air or gas, larger patients are harder to examine, it has difficulty penetrating bone, which excludes infants, and it develops heat within the body and heats the localised area, which can result in cavitation. So I think that's pretty much everything that you need to know about ultrasounds. I hope you've enjoyed this video, and thank you for watching.